One of the most uncomfortable topics to talk about amongst others is about your bowel movements. So today I will be discussing the different colon diseases, their causes and effects on the body, while also using personal examples. So many people experience occasional constipation, however that's not always the case for everybody. I've taken anatomy and physiology twice, and I've also worked on cadavers, which are dead bodies that have been preserved. And I also have my own colon problems, so I do understand a little bit how the human body works and the digestive system specifically. Colon disease has many different types, both simple and life-threatening, while also having multiple causes and treatments. So since I've introduced the colon disease, I will now discuss the anatomy and function of the colon itself. So the large intestine is actually the colon itself, and it is 5 feet long, and the rectum is 8 inches long. There are 4 different sections to the colon, which are the ascending colon, descending colon, transverse colon, and sigmoid colon. All of their functions are to absorb water and salt in order to transport fecal matter down to the rectum to be excreted later on. The muscles are coated with healthy bacteria, so it can create a healthy balance within the body. The 3 categories of colon disease are structural, functional, and colon and rectal disorders. So I've explained the structure and function, now I'll explain the specific disorders. So functional disorders include constipation and irritable bowel syndrome. Constipation is when a person has difficulty making bowel movements on their own, and typically this is because it's a lack of fiber in the diet and not enough water intake. However, this is not always the case for everybody. There can be underlying causes that haven't been found out yet. So irritable bowel syndrome is when the colon tightens in an abnormal way, causes severe abdominal cramps, and this is also a digestive disease, not just a colon disease. So colon and rectal disorders is next, and diverticular disease is when there are little polyps, which are sacs that line the colon wall and that pushes through. However, there are not always symptoms, so this could include internal bleeding, which can down the road become very serious and life-threatening. Colon cancer is when cells in the bowels start to grow and multiply, and polyps also line the wall. And occasionally the patient does need a colostomy bag, which is where the fecal matter actually drains into the bag to excrete the matter. And to get rid of this, usually a patient needs chemotherapy and surgery or radiation. Colitis is the inflammation of the inner lining of the colon, and there are 5 types, which are the infectious, ischemic, radiation, ulcerative colitis, and Crohn's disease. They all have similar symptoms and include rectal bleeding and abdominal cramps. However, they do sometimes have different treatments because they all are their own separate disease. So I've explained the types of diseases. Now I'll inform you about the different treatment options. So it can be frightening at times if you have a disease. However, there are multiple ways to prevent a disease from occurring, and there are ways to treat it. And colonoscopy is the first way that can be a preventative method. And this is when a doctor inserts a little camera called an endoscope up to your rectum to look through your entire large intestine to see if there are those little polyps, because those are what develop into cancer cells and can divide. So this is the most common, and I got this off of a scholarly article off of the COC website, and the author is Ladovsky. My uncle also had colon cancer around this time last year, and he had to go through multiple rounds of chemo. So chemotherapy is a treatment option, and this is when drugs kill the cancer cells itself. However, there are so many different cancers that the dosages do vary depending on the cancer and the stage, but they do all produce common symptoms such as nausea, vomiting, weakness, and hair loss. So because I'm done explaining the treatments, I will now begin to wrap it up. So colon disease has many different types, both simple and life-threatening, while also having multiple causes and treatments. The colon is also known as the large intestine, and its function is to absorb water and salt to transport the fecal matter to the rectum. The functional disorders are most common, which include constipation and irritable bowel syndrome. I've taken anatomy 2 times and I have my own colon problems, so for me, when I research this stuff, it makes me feel more in tune with myself, and also it allows me to have the desire to help other people down the road. So I understand talking about intestines and fecal matter is not the most pleasant topic to talk about, but it is how things can get discovered and discussed, so which is very, very important in the medical field. So thank you for listening to my talk about colon disease.